Intensive Voice Treatment (LSVT Loud) for Parkinson's disease following deep brain stimulation of the subthalamic nucleus was conducted by Jennifer Spielman et al., which was published last 2001. Pre-test, post-test control group design. The objective of the study is to determine whether outcomes for surgical subjects were comparable to non-surgical cohort. The study evaluated voice and speech in individuals with and without deep brain stimulation of the subthalamic nucleus before and after LSVT Loud. The participants were 8 people with Parkinson's disease. 4 with deep brain stimulation of the subthalamic nucleus and 4 without. The independent variable is LSVT Loud program, and the dependent variables are VAI or Vowel Articulation Index, VHI or Voice Handicap Index, and SPL Sound Pressure Level. LSVT Loud was administered by 3 SLPs with expertise in the delivery of this therapy. SPL, VAI, VHI, and a structured interview were evaluated before and after treatment, and again 6 months after. Treatment consisted of 16 sessions of individual therapy delivered according to the standard of LSVT Loud protocol. Untreated group did not receive treatment in the whole course of the study. The Lilly Force test was used to determine whether acoustic data in this study were normally distributed. VAI scores for each subject were treated as the response variable in a RM ANOVA. Pre to post and 6-month follow-up of both treated groups showed a significant increase in SPL. For VAI, treated groups had significantly higher results for treated compared to untreated subjects at follow-up. For VHI, several treated individuals had significant clinical improvement, particularly within the LSVT DBS group. The untreated group exhibited no significant changes in any measure throughout the study.
Effect of Lee-Silverman voice treatment on swallowing and cough in Parkinson's disease, a pilot study. The authors were Ana Milesa et al., and the publication date was 2017. The study aims to investigate the additional spread effects of LSVT Loud on deglutition by measuring quantitative swallowing and cough parameters in a group of patients referred for voice treatment. 20 participants of 6 women and 14 men with a mean age of 68 with an average duration of 6 years of Parkinson's disease were chosen to participate in the study. The independent variables are video fluoroscopy and LSVT Loud treatment. Dependent variables were pharyngeal residue, pharyngeal area at rest, maximal opening of pharyngoesophageal segment, PES opening duration, involuntary cough peak expiratory flow rate, and peak exploratory flow rise time. For the data gathering, a full LSVT Loud program was given to each participant to be completed with similar treating clinician. After the treatment, each participants were subjectively rated by the LSVT Loud clinician on a scale of 1 to 5 regarding motivation and commitment. For the data analysis, the dependent variables were each analyzed using repeated ANOVA measures, which were measured 3 times. If the ANOVA was found significant, changes from pre-LSVT Loud and 1 week post-LSVT Loud and between pre-LSVT Loud and 6 months post-LSVT Loud were determined by completion of Bonferroni post-hoc test. Lastly, Friedman testing using Wilcoxon signed rank test was used with post-hoc analysis when assumptions were noted to be violated. All the participants made significant gains in average sound pressure level and aspiration was not observed. Pharyngeal residue and pharyngeal area at rest were reduced, while maximal opening of the PAS and PAS opening duration significantly increased. Significant improvements were noted as well for involuntary cough, peak expiratory flow rate, and peak expiratory flow rate. All these were maintained in a 6-month duration.
Intensive voice treatment via the use of LSVT Loud for children with spastic cerebral palsy and dysarthria. The authors of this study are Cynthia Marie Fox and Carol Ann Bollier, published in 2012. Objectives: to examine the effects of an intensive voice treatment, the Silverman voice treatment, commonly known as LSVT Loud, for children with spastic cerebral palsy and dysarthria. The study is a post-test only control group design. So for the participants, 5 children between the ages of 5 and 7 years with a medical diagnosis of predominantly spastic cerebral palsy were recruited. The independent variable for this study is the LSVT program, while the dependent variable is spastic cerebral palsy. For the data gathering, LSVT Loud was administered by one clinician, the first author. All treatment sessions were conducted in the participant's home. The first half of each consisted of 3 tasks. The second half was spent on speech hierarchy, progressing in difficulty from single words to conversational speech. For data analysis, auditory perceptual data was analyzed using 2 chi-square tests on the categorical assignment of preference for each participant. Acoustic data checking for serial dependency in the data by running a lag1 autocorrelation Pearson on neighboring data points in the baseline. If there were no significant autocorrelation, then the data was averaged in each phase and conducted a one-way repeated measures analysis of variance, or an ANOVA. For the results, all of the participants were noted to have improvements in their voice quality. For listeners, there was a preference of the post-treatment over the baseline. However, all of the performances for maximum F sub-0 range were 2 standard deviations below their typically developing peers, all from base to post. The perception of parents for their children's voice quality were noted to be very significant, but this eventually decreased as the effects of the treatment did not last over time.
Lee Silverman voice treatment versus standard speech and language therapy versus control in Parkinson's disease, a pilot randomized control trial. The authors are Catherine Sackley et al. It was published on 2018. The aim of the study is to assess the feasibility and acceptability of a large-scale randomized controlled trial to assess the clinical and cost-effectiveness of LSVT Loud versus standard speech-language therapy versus no intervention in dysarthria associated with Parkinson's disease. The type of design used was pre-test post-test control group design. There are 89 participants with idiopathic Parkinson's disease with presence of patient or carer-reported problems in speech. 30 participants of which received the LSVT program, 30 received conventional speech and language therapy, and 29 will not receive any intervention. Independent variables were LSVT program, conventional speech and language therapy, and no intervention, while the dependent variable is the Voice Handicap Index, or the VHI. For the data analysis, baseline vocal assessment was done prior to randomization into 3 groups. LSVT Loud was administered in 4 sessions with 50 to 60 minutes each per week for 4 weeks by a registered SLP certified in LSVT. Patients were also asked to carry over the task for 5 to 10 minutes at home on a treatment day and 30 minutes on a non-treatment day. Therapists providing the interventions completed intervention record forms at each session. Pearson correlation coefficients was used to compare participant-rated and therapist-rated scores. Results showed that correlations between reported outcomes correlated well with each other. Vocal loudness did not correlate well with the patient-reported measures. The primary outcome measure is VHI. Significant changes in VHI scores were observed for the LSVT and speech-language therapy groups.
The effect of Lee-Silverman voice treatment (LSVT) on Parkinsonian phonation, nonlinear dynamic perturbation, and perceptual anatomy. Song-Hee Choi, published on 2011. The study aims to investigate the effectiveness of LSVT on voice of individuals with Parkinson's disease using acoustic and perceptual analysis for evidence-based practice. It also aims to evaluate whether nonlinear dynamic methods can be used to quantify aperiodic phonation, which is frequently exhibited in Parkinsonian voice. 15 idiopathic Parkinson's disease patients participated in the study. They were further divided into control and treatment group. The independent variable was LSVT program. Dependent variables were jitter, shimmer, and correlation dimension. LSVT program was administered by a speech-language pathologist 4 times a week for 4 weeks with the treatment group. Nonlinear dynamic methods with traditional perturbation measures were used to test treatment effect to quantify aperiodic Parkinsonian phonation. For both groups, acoustic and perceptual parameters with sustained A were obtained pre-test and post-test. Perceptual analysis involved the rating of 3 listeners on general vocal impairments with sustained A vowel segments. Results demonstrated that both jitter and correlation dimension were significantly lower following LSVT, whereas shimmer values were not. For the control group, pre-test and post-test results revealed no significant differences. In addition, perceived vocal quality was improved following voice therapy for the treatment group, while no change was found in the control group.